Turning to health news this morning, the Montgomery Regional Medical Center will be hosting a free peripheral vascular disease screening.
You said it, I didn't.
That's a mouthful.
The screening is part of the medical center's Leg Up program. They give me the easy words. Here to tell us more about it is Dr. Wesley Berry. Dr. Berry, thank you for being with us.
Good morning.
Thank you so much for having me.
This is a vascular screening. Tell us what that is.
Well, peripheral vascular disease, of course, is that entity that describes patients who may have partially or totally blocked arteries of their lower extremities or of other parts of their body, but particularly the lower extremities. These patients may walk around with partially blocked arteries and not even realize it.
Now, I understand this is part of the Leg Up program. Tell me, what is the Leg Up program?
Well, I think what it really describes is just as I've said, you know, the most prominent symptom associated with peripheral vascular disease of the lower extremities has to do with walking. And this may be patients who walk short distances and then experience pain in their thighs or in their calves and they have to stop and rest. Well, certainly, if we can detect this disease early before the artery is totally blocked, we're able to do minimally invasive procedures in order to get those arteries open and functioning again and to save legs, to save limbs, to save feet.
Now, are there some things that people can do to keep from developing these symptoms?
Well, there are many things. It starts back in our early eating habits, probably from teenage years, obviously avoiding high fatty foods, cigarette smoking. Some of it has to do with family history, exercise or lack thereof, obesity, of course, a high association with diabetes. There are many factors involved here.
And again, as you're saying, I know diabetics particularly are very prone to circulatory problems. Who else needs to make sure to get out to this screening?
I would say anyone probably above 35, diabetic, people who have sores or ulcers of their feet or legs that won't heal, people who have noticed some difficulty with walking several blocks and as I've said earlier, have to stop and rest in order to continue that walk. And unfortunately, though, the reason for the screening is that many people may walk around with partially occluded arteries and not even realize it, because many of us don't walk far enough to claudicate, meaning we don't walk far enough to have symptoms. And that's the reason for the screening.
Well, Dr. Berry, we have some information we're going to put on the screen here. It's a free screening at Montgomery Regional Medical Center. It is this Saturday, April 25th. That's tomorrow. And it's from 10 in the morning until 1 in the afternoon. If you want to find out more about this, just call that number there, 269-8652. Dr. Berry, thank you very much.
Thank you so much for having me.
Thank you.